here is a solution to overcome patient resistance to paying at time of service. Simply keep a credit card on file. So, Naren, let's say you're my patient and I'm the financial coordinator. Naren, because we're no longer contracted with Delta, they're now going to send you that check directly. I wish they would send it to us like they always have, but they won't. They make it difficult. One of the things we can do is I can, with your permission, I can keep a credit card on file, and you can sign this authorization so that we can do that. And we'll charge your card in 2 weeks from now for the amount today. Here's the balance today. By then, you should have that check from Delta. In fact, you should have it well before then. And what some of our patients like to do is simply keep a card on file, and then we'll charge that in the future on an agreed upon date. And that has worked very well for many of our patients. Would you like to handle payment that way? So simply keep a card on file, that authorizes you to be able to charge their card, for that amount. And that becomes a way that softens the change of having to pay at time of service when they never had to pay before. That can be, just another option you can have on your hip pocket. You may choose to do that for all of your patients, and you may choose to do that with some. But there's another way to handle it that works for you and works for the patient. Remember, the patient's not even going out of pocket in that method, because they will get the check from Delta before you have the agreed upon date to charge their card. So that is something we wanted to bring up, on this podcast, because that's something that for some of you that feel like that may be a deal breaker for your patients. I hope it's not. But if you know your patients better than I do, by the way, that has not been a deal breaker in our experience coaching with people paying at time of service, especially if you are a relationship-driven practice where they know, like, and trust you. That it's a change, and let's be blunt, people don't like changes.
Right.
You don't like changes. That's not how we did it before. We get that. So oftentimes, we can overcome that with good verbal skills and good training from our team. And you can overcome that by strengthening the relationship-driven aspect of your practice. Because the more you're connected with your patients, the more you know about them and treat them as the individual that they deserve to be treated as, then they don't want to go anywhere else for their dental care. But for some of you that may have a situation where you want a buffer and you want to retrain your patients, that credit card on file may, in fact, be that very solution.